is Mark Boutin from the National Health Council. He's the Chief Executive Officer of the National Health Council, and he became a patient advocate more than 20 years ago and has been a leading voice for greater patient involvement at every stage of the healthcare continuum. Mr. Boutin, thank you so much for being with us today.
Thank you, Bob, for the opportunity. And I just want to take a moment and thank all the other presenters who have been incredibly powerful. And I know we have several more to go. More than 20 years ago, I found myself in a situation where over about 4 months, everyone in my family was diagnosed with one or more chronic conditions. They ranged from heart disease to cancer, neurologic, autoimmune, ultra-rare, and HIV. It was an incredibly powerful moment, and I ended up becoming a family caregiver for many of the folks that had previously cared for me at a relatively young age. Unfortunately, a few years later, each of them lost their lives over a relatively short period of time. Some of them passed away because there were no effective treatments for the conditions that they had. Others passed away because there was inadequate care to treat them, even though there were very good treatments for them. I became a patient advocate, volunteering with a number of patient organizations, and was absolutely stunned by the lack of voice that we have, how unheard we feel when we are in the healthcare system. That was 20 years ago. And 20 years later, I am now a 3-time cancer survivor. I have a significant autoimmune condition that has impacted my life over the course of the last year, making it very, very difficult to eat. I've gone back into the healthcare system, and while the treatments have improved greatly, by and large, the care has not improved all that much. It's incredibly challenging, and I want to begin by saying that all of the folks that work in primary care have always been our closest allies, helping us get the care that we need. But the reality is we have a healthcare system that has been characterized by paternalism for centuries. And while it's less overt currently, it still exists. And I've worked as an advocate for a long time, and I've met thousands and thousands of people who are great people with incredibly positive intentions. But by and large, the vast majority make the same mistake. Because they have good intentions, they make the assumptions that they know what the person or the family sitting in front of them wants. It's a grave mistake. When I look at what people actually want and how it correlates with how other surrogates think and believe that they want, there's often a huge disconnect. I'm currently the CEO of the National Health Council, which is an organization created by patient organizations for patients. It's nearly 100 years old. We have representation from all stakeholders within the healthcare system, and we focus on ensuring meaningful and affordable access to care. We strive to elevate the voice of patients and their family caregivers in policy and in health. We've been at the forefront of the creation of the Affordable Care Act, people-centered research, PCORI, patient engagement in drug development at FDA and globally, all looking at how we can elevate the voice of the patient. But when I speak with people involved, again, they think they understand. At the end of the day, people care about 3 activities: whether they will survive, how they feel, and how they function. The challenge is that you got to get the balance right amongst those 3 things. I remember being at a meeting with people with Duchenne's muscular dystrophy, an incredibly challenging disease, one that is 100% fatal. And the disease advocacy community had de-risked that area so that you had multiple companies working on treatments, working with regulators. And they focused in on a traditional oncology model of trying to extend life by 6 months. And yet when you ask the families, when you ask the boys living with this disease, if they wanted to live an additional 6 months, what they told you was no. At the last 6 months of life, I can't move, I can't breathe. I'm afraid I'm going to choke to death on my own saliva at night and be unable to call out for help. I don't want to live 6 months like that. What I want is the ability to grab my sleeve with my teeth and throw my hand on an iPad and type out a message to my friend. Give me 6 more months of that functionality and I'm with you, I'm good. When I speak with doctors, they say, I spend 65 to 70 hours with people with this disease. I know what they want. And yet when you do a survey of the doctors and you compare it with the patients, you will find a tremendous mismatch. We have a long ways to go. We need to understand what people actually think and feel. At the end of the day, wellness lies at the center of all the determinants of health. Biologic, social, economic, environment. And I love Winfrey's idea of including racism. All the determinants of health and our desired outcomes. And when it comes to primary care, we need to be able to examine all the circumstances you find that individual and their family and be able to develop a care plan that actually helps them to achieve their goals. If I could give 2 recommendations, they would be this. Let's create 2 process measures. One, and this is just a process measure, not an outcome measure. Did you ask the patient and their family caregiver what their goals were? And be very clear, and this was alluded to earlier by Alyssa, there's a huge power dynamic. When we are sitting on a table in a hospital gown, essentially naked, hoping to get the care that we need, hoping that that care will continue over time, we are disempowered. We're not going to be as honest and direct with you as you would like. But imagine if you had a process outcome that actually took the time to understand the circumstances we lived in and what our goals actually were. And then add a second process measure, again process, how was the care designed to help that person and their family achieve the goal that was most important to them? Those 2 process measures would dramatically change how health is viewed, how it works, would help us get to the outcomes that matter, would have huge implications for how we deal with care that is unnecessary, unused, huge implications for costs. It gets to many of the things we've heard before about trust and how we relate to one another. At the end of the day, what we're really looking for is for the healthcare system to be a tool that helps us live our best life possible. None of us go into the healthcare system simply for health. Nobody does that. I don't go into the healthcare system so that I can take a medicine. I don't go into the system to see my doctor. I don't go in for the next surgery. I use the healthcare system because I, like everybody else, wants to be happy. It requires a relationship that brings us together and really understands what goals are important to us, how we can be heard, how we work together. I look forward to the Q&A.